It's Tuesday, October 29th, and this is the Daily Medical News, where we bring you the top headlines in clinical medicine, plus an in-depth look at today's biggest story. I'm Mary Ellen Schneider.
And I'm Nick Andrews. Today, why treating hypertension could significantly cut Black patients' cardiovascular disease burden.
Birth year may be destiny when it comes to influenza susceptibility.
Cancer overtakes cardiovascular disease as a cause of death in high-income countries.
And urban or rural, children's gun-related injuries are equally deadly.
Plus, how to make your practice welcoming and inclusive for LGBTQ patients. But before we start, we'd like to ask for your help in making this podcast a little better. Please take a moment to complete our short listener survey by following the link in the show notes. And now, the top news in clinical medicine.
Hypertension may be driving a significant portion of Black adults' greater cardiovascular disease risk. About 1/3 of cardiovascular disease in Black adults can be traced to hypertension, and the influence is much stronger in people younger than 60. That suggests early interventions to maintain normal blood pressure could reduce risk. Those are the key findings from a prospective cohort study published by researchers from the University of Mississippi in Jackson. Their research appears in JAMA Cardiology. Hypertension is the leading contributor to cardiovascular disease in the U.S., and non-Hispanic Black adults experience it at a rate of 55%, higher than any other group. The researchers used data from more than 12,000 patients in 2 studies to determine the link between CVD and hypertension. They found that hypertension was independently associated with incident coronary heart disease, heart failure, and stroke. Patients with elevated blood pressure and hypertension were more likely to take cholesterol-lowering medication compared with those with normal blood pressure. Hypertensive patients were also more likely to have diabetes.
The influenza strains that were circulating the year a patient was born may shape that patient's susceptibility to flu subtypes. That's according to infection patterns during the 2018-2019 flu season. CDC researchers presented the findings at the ID Week 2019 meeting. The H1N1 subtype circulated during last year's flu season. Among nearly 19,000 patients hospitalized for flu last season, there were more H1N1 infections in 2 groups, those born during 2010 to 2019 and those born during 1948 to 1995. The investigators found some protection against H1 flu viruses in younger people who were exposed to H1N1 in their first year during the 2009 pandemic. There was also some protection in older people exposed to a young age to similar H1N1 viruses. The researchers say the early exposure relationship could have implications for flu vaccine effectiveness in various age groups, and it could influence the composition of flu vaccines based on the ages of the people who will receive them.
Cardiovascular disease still accounts for 40% of deaths around the world, but cancer is eclipsing it as a cause of mortality in high-income nations. Dr. Salim Yousuf of McMaster University in Hamilton, Ontario, is the lead author of the PURE study. That epidemiology study looked at 202,000 people from 27 countries. When the researchers stratified cause of death by country income level, a striking pattern emerged. Fully 55% of deaths in high-income nations were caused by cancer, compared with 30% in middle-income countries and 15% in low-income countries. In contrast, cardiovascular disease was the cause of death 23% of the time in high-income countries. That figure rose to 42% and 43% for middle and low-income countries, respectively. What's driving the trends in high-income countries? Speaking at the annual Congress of the European Society of Cardiology, Dr. Youssef offered an answer. We'll be back after this message with more medical news.
Welcome back to the Daily Medical News. I am Nick Andrews. Accidental firearm-related injuries among children occur more frequently in rural areas than in urban locations. Regardless of geographic location, those gun injuries carry the same mortality and disability risk, and nearly 60% of such cases are potentially preventable. That's according to a study being presented at the annual meeting of the American Academy of Pediatrics. University of Pittsburgh researchers analyzed location preventability and temporal trends of pediatric firearm-related injury in 184 patients aged 18 and younger. 43% of the firearm-related injuries occurred in a rural location. Compared with children who were injured in an urban setting, those who were injured in a rural setting were younger and more frequently injured by accident. The rates of death or disability did not differ significantly based on location of injury, occurring in 16% of rural and 13% of urban patients. 72% of accidental injuries occurred on the gun owner's property, and 58% were considered by the researchers to be potentially preventable. The investigators say the findings emphasize the need to promote safe firearm storage among populations with high rates of potentially preventable injuries.
What's one of the most important things doctors can do to support their lesbian, gay, bisexual, transgender, and other gender nonconforming patients? Ask them about their feelings, preferences, and experiences when it comes to gender and sexuality. That's the advice of Dr. Julie Finger of Tulane University in New Orleans. Speaking at the annual meeting of the American Academy of Pediatrics, Dr. Finger cautioned that it's equally important not to make assumptions. Specifically, doctors shouldn't assume patients are heterosexual or that bisexuality is a phase. Don't assume that orientation or attraction translates directly to behavior or vice versa, and don't automatically think that LGBTQ patients have unsupportive families or are engaging in risky behavior. Dr. Finger says you also can't assume a patient's sexual orientation based on their partner's gender or determine a patient's sexual orientation or gender identity based on appearance, or even that either is the same as it was on the previous visit. What doctors can be sure of is that they do have LGBTQ patients. According to a 2016 Morbidity and Mortality Weekly Report, about 1 in 10 students in grades 9 through 12 is a sexual minority. About 2% of respondents identify as gay or lesbian, 6% identify as bisexual, and 3% say they aren't sure. Instead of focusing on why a patient is LGBTQ, Dr. Finger says it's crucial to focus on what that means for them in their life. How does it affect their relationships and their behaviors, and how do they feel about it? How are they being supported by their family or their community, and how is it impacting their lives? For more of Dr. Finger's perspectives, including terminology tips, what to ask patients, and how to create an inclusive practice, click the link in the podcast notes. And that's it for today's Daily Medical News. If you like what you hear on the Daily Medical News, please leave us a review or rating on Apple Podcasts. For MD Edge, I'm Mary Ellen Schneider.
And I'm Nick Andrews. Remember, you can check out the full stories via the links in the podcast notes. Thanks for listening to the Daily Medical News.